Good evening, ladies and gentlemen, White Sands teammates. Thank you for joining me this evening as we continue our series of evening updates. And let me start with the latest information we have from the local area. First, let me start with El Paso and Juarez. As of this afternoon, there were 3 confirmed cases of COVID-19 in El Paso and 1 in Juarez. As of now, they are not saying there was any community transmission. They believe all 4 of those were travel related. To New Mexico, there are now 28 expected or confirmed cases of COVID-19 in New Mexico. There is 1 case in the Albuquerque area that is expected to have community transmission. When that's confirmed, that'll be the first case of community transmission in the state of New Mexico, and we're working with the state to find out more details as far as that goes. Locally, we have 13 folks in quarantine in New Mexico, in White Sands Missile Range. Of those 13, 1 of them has been tested, and we're awaiting the test results. The folks that were in close contact with the individual are also in quarantine and will remain so until we have the results. Now, let me explain part of what happens when you think you've been exposed and we put somebody in quarantine. Part of this is when we put someone in quarantine, we're tracking and making sure that we're tying in with our medical professionals and following their advice. And because the incubation period is less than 14 days or less, this quarantine isolates the person to protect against the transmission for that period of time. And if they're asymptomatic at that time, meaning they're not showing any symptoms, then there is no reason to believe that they've got COVID-19, and then they're released from quarantine and then expected to continue duties. In the case of somebody who is symptomatic, that's a discussion, again, with the medical professionals so that they're understanding exactly what's going on, and they're going to go through a series of protocols. And they've got a very complex matrix trying to take into account all the possibilities. And in as much as possible, folks are being kept in their home for quarantine unless they get to the point where they need medical attention, in which case they would be transported to medical attention. So even if somebody tests positive for COVID-19, if it's a mild case, they will be kept in quarantine in that point in time. The medical community stops calling it a quarantine and calls it isolation, and will keep them there until they are symptom-free, and then test them to ensure that the disease is passed, and they've got protocols for how many times they test to make sure that they are no longer able to pass the disease on to anyone else. So I think that's important to understand, and why we put people in quarantine and why they can come out of quarantine, and understanding how it transmits. We've reached out through IMCOM channels to both AAFES, the folks that supply our troop store, and DECA, the folks that supply our commissary, and are working diligently to get increased distribution from them, given our remote and isolated conditions. And the challenge right now, just so we're clear, is there's a distribution challenge across the United States. And part of that is because people are attempting to hoard and really buy much more than what they need out of fear. And you've seen it, whether you've seen it on the news or you've seen it in person at one of the large chains. You know what's going on. And what I would ask is that you think about the community that we're in when you're going somewhere, and that you're trying to take care of the community. For that reason, we are rationing certain items at the commissary and the troop store to ensure that folks get what they need and can move forward as far as that goes. I want to clarify a comment I made yesterday. I made a comment when I was talking about places to eat still being open, whether that's the bowling alley, Subway, or the Frontier Club. And what I said was, if you're comfortable, stay away. And that's really the wrong words to use. If you are not comfortable, I would submit you should choose not to do things that you're not comfortable with. But if it's something that you're not comfortable with that is based on decisions that we are making, we need to have the feedback so we understand why you're not comfortable, and we can take things that we may not have considered into our decision calculus. There are many comments about WSMR not doing enough. Let me assure you, we are proactively assessing and adjusting our posture several times every day to include the guidance that we're getting. And what I'll tell you is we are leaning forward and not waiting on guidance to move out. A perfect example is in our information sharing. Our COVID-19 buttons and web page went live on our internal website on Friday, externally on Monday due to complications. And of course, today we received direction to move out in that and have a page where folks can go as a one-stop shop. And so that's just an example. I know it's a minor one, but that makes it easy to share. Before I get to today's questions, there's two things that I want to get through. The first one is installation access. And so yesterday I shared that the museum's closed and that we have suspended all off-post bowling leagues. And so the question was, well, so is the post shut down? Well, the post is open to folks that work here, live here, and have access to the post, and what I will call affiliated visitors. So we want our trucks to deliver supplies to our troop store, the bowling alley, etc. And I think you're tracking. We want your Amazon or whatever orders that you ordered online to be delivered. And so those folks will be able to get on the installation. If you're just passing through and have no affiliation with the military, then those are the folks that we're asking not to come on post at this point in time. Now, McAfee, I think it's important to understand that as conditions change and we learn more, that conditions at McAfee will adjust to the appropriate posture. As such, anyone who's trying to enter the McAfee clinic is going to be screened at the main entrance, and that's the only way to get in. And that's to ensure that we're not bringing folks in that have COVID-19 to where they can spread it to other folks. Additionally, the clinic is working in collaboration with the units on WSMR to ensure that the folks that we have returning from Oconus, so outside the continental United States, are quarantined and monitored for symptoms to make sure that we're, again, doing the separation to protect against transmission. Appointments are generally being moved to telephonic consultations with as much virtual health as possible. If you've got symptoms, call the McAfee number 575-674-3500 if your care is provided by McAfee or your provider to get specific instructions and so that they can be prepared if you need to come in for what your particular conditions are. And so really doing a great job and proactively working to be prepared to take care of us and ensure that they are not transmitting any cases that could come into the clinic. Now to the questions for today. The first question, I work for the garrison and I have just been told by my supervisor that telework is not authorized for garrison personnel and we are to come into the office as usual until otherwise notified. It goes on to say that essentially that's not what I said in my video yesterday. So I do not doubt that that's the conversation that you heard, but that is not the guidance that the garrison commander has provided to his directors. And so the authority for telework inside garrison and the folks that work in garrison has been delegated to the director level. There are some positions that do not provide opportunities for teleworking. And so I think be conscious of that when we look at it and where we are and the missions that we need to support when asking the question about teleworking. The second question, if a person is told they will telework and after a period of time they run out of work before their scheduled workday is over, would they be required to take leave, and what type of leave? Work with your supervisor. You should have more than enough work before you begin the telework, and you should have constant conversations with your supervisor so that you don't run out of work in that situation. And if there's an issue, have your supervisor engage their supervisor and on up so that it can get resolved. Because if you're being told to telework, you should be given the work to do so you can do a full and productive day. The next question, I work pretty far below the supervisors, but I'm getting the impression that this disease isn't being taken seriously by parts of our command group. I'm thankful for Colonel Tribula's approach to remotely share information. I'm sure this is a complicated issue and the need to be flexible. I see efforts to take care of people first. I am worried when I see other armed forces at WSMR, government agencies in our community, private businesses, etc., pulling up the drawbridges to protect their employees, but yet we post signs on the exterior doors of our buildings discouraging entry. We continue with newcomer orientation. Are we waiting for the first member of Team WSMR to be infected by COVID-19 before we do more than discourage people from entering our building? Can you forecast what the tipping point will be when we are able to change our behavior? Let me take this in several parts. So it starts with I'm pretty far below the supervisors. So while it may be possible that you work on the first floor and your supervisor's on the third floor, there is nobody who doesn't have a supervisor immediately above them. If you're not in daily contact with them, I would ask that you change that. Contact could be email, could be phone, could be in person, but you should be doing that on a routine basis, especially now. In terms of, I'm worried when I see other folks doing, essentially shut their doors and doing nothing. Part of this depends on what an organization's mission is. And so we have 15 different organizations on White Sands Missile Range. Those are the ones that are here permanently. And there is an incredibly diverse mission set across those organizations. And depending on what that is and how critical to ongoing operations or other national security needs are, is going to depend on the posture that that organization can take. In some cases, we have some buildings that are secure facilities, and their doors are locked all the time because of what they do inside those facilities. And they are that way for security purposes. We need to practice social distancing when we move around. And so I think it's important to understand that those differences are out there, and what we are trying to do is maximize taking care of all of our workforce and our community while understanding that this is a Department of Defense installation which is unique in terms of what it provides for national security, and we have ongoing mission requirements to support both national security and our warfighters. Now, there was a point in here about we continue with the newcomer orientation. And I will tell you, yes, I kicked off the newcomer orientation this morning. Think about where we are today. And if you are someone new to this installation, you've got enough to be worried about with COVID-19. Do you want to know nothing about the installation? As the installation commander, it is my duty to ensure that folks have an understanding of where they are and what opportunities are available and where they can get different information and different support and different resources to enable them to operate healthily as an individual and as part of the team. Prevention measures were put in place. Social distancing actually made it awkward at the newcomers' orientation. Nonetheless, it was important enough to ensure that those members of the workforce were provided that information today to go on with that. So I think it's a valid question. And please, when you see something you don't understand, ask the question. But I would also ask you to put yourself in other people's shoes and say, does this perhaps make sense from another perspective? The next question. If we are to remain in place and work like normal, will we be able to use teleconference calling sometime soon? This resource would allow us to remain a little more socially distant and still work for the American people and our soldiers. So, great point. And first of all, we shouldn't be working like normal. We should ensure that we've got social distance and that we are providing space between people and adjusting things. What I would ask is pull up the manual for your phone. Most phones have got the ability to teleconference and dial in more than one other party. So your phone may already have that capability. Additionally, there is DCS, Defense Collaboration System or something like that, which you can go online, apply for an account, and actually get it to work over your computer. Furthermore, you get an opportunity with Business Skype, and if it's not on your computer, you can get with the help desk and get it installed on your computers. There are multiple different options, and I would highly encourage everyone to pursue those options. There's also conference bridges, which of course are limited given that everybody's trying to get to them. And that is one of the things that I'm doing for meetings. So I have a weekly meeting where I'm bringing together all of the tenant organizations leadership at WSMR, and that's going to be via teleconference. And there's a dial-in number, and those leaders will dial in, and we will do that remotely to support exactly what you're talking about. And what I would ask is, if you find a creative solution that's not apparent, that's within the confines of the security that's required in government systems, please share it so that we can afford others of the same opportunities. The next question is, I understand that the Advanced Intermediate Air and Missile Defense will be active on WSMR soon and continue for a while. This seems counter to the guidance being shared. Is this true? Will we see a contingent of soldiers on the installation, or is this event pending escalation of the COVID-19 outbreak? Was a waiver granted? Are the powers to be asking these people if they've traveled through any countries of concern? If someone feels sick while present on WSMR, will they have the latitude to stay in their hotel room or self-quarantine? How will they be served food without having to go to the PX or the Frontier Club? So this is actually a great case. When you hear me talk, hey, we've got missions going on. Well, what are some of those missions? So we have, in this case, one of the Army's top priority modernization efforts, which actually has impacts to, let's just put it this way, soldiers currently in harm's way. And that testing to continue is going to need Vice Chief of Staff of the Army approval. And it is being worked for the Vice Chief of Staff of the Army to approve that event continuing. At the same point in time, that event is not going to go on as originally forecast. So instead of bringing in hundreds of folks from across the United States to oversee and be the evaluators and assessors for a unit coming from Fort Bliss. The intent is that those folks will almost entirely be resourced from White Sands or Fort Bliss, and that the unit is coming from Fort Bliss. And just like we're asking everybody if they've been overseas and we've got procedures in place to ensure that they're quarantined, we're doing the same thing with the folks that are coming here to ensure that they have not been overseas within the last 14 days and making sure we mitigate. The expectation is that the preponderance of these folks are soldiers, and that the preponderance of these folks are actually going to be in the field doing training and then testing for an extended period of time. Will you see some of them on the installation? Absolutely. Are you going to see some of them using the PX or the commissary or the club? Depending on their conditions, yes. And that is no different than someone who goes down to Fort Bliss or comes from Fort Bliss to here and can do that. But the preponderance of the test is going on out in the field, on the range. It is not going to have the interaction of most of those folks with the local community. The next question. I work on WSMR for a subcontractor. Our primary contractor is on a firm fixed price contract. In the event WSMR should have to close up our doors for a while, do firm fixed contract workers get paid? We won't have choice in the matter, or will it be like during government shutdowns where government workers get back pay, but contractors just have to suffer for it? We can't take home work, but would gladly do so. This doesn't have a great answer, okay? And so let me start out with my relationship with the contract employees and my ability to actually ensure that an employee is taken care of. We have provided access on the installation in as much as we can to the same facilities and resources as the rest of the workforce, and your contributions to what is being done in the mission is critically important along with the rest of the workforce. That said, the government's relationship is with the contractor, not the contract employee. And so I can't tell you what your employer or since you're on a sub, what the prime is going to do if something should change. We are assessing what work needs to continue going on as conditions change. And if conditions change, as good stewards of the government's or of the people's money, your money as taxpayers, it is our duty to ensure that if we've got a contract that we don't need, that we're looking at what we can do to adjust that contract for the work that needs to be done. What's that going to look like in the future? I don't have a crystal ball. I think it's on back order. No, seriously. It's one of those things that the situation is going to evolve and we're going to learn. I care about you as an individual. We want to make sure that you're part of the community, but that doesn't mean that I've got the legal abilities to do everything as far as that goes. And I know that's not a great answer, but that's the best one I have right now. The next question. According to New Mexico Department of Health, there have been 1,720 tests done in the state. However, there is no information on how many have been done in the local county. Can you provide information to us? The general feeling is that we probably don't have any positive cases here due to the lack of testing rather than lack of the virus. Have the persons in quarantine at WSMR received tests? So there is no information on where in the state those 1,720 tests have come from. In terms of the folks at WSMR, as I started out, we have one person that has been tested and we're awaiting the results of that. The other folks that are in quarantine are in quarantine based on potential exposure to other folks and then have not met the thresholds where the medical community says that they should be tested. If that changes, they will be tested. Next question. I understand WSMR installation is now only accessible for official business and residents. Under this circumstance, are we able to have the CAC access to buildings with CAC pin access between core hours? We normally implement such measures during installation physical security drills. This will aid in the precautionary measures to protect the health of the force, civilians and military in our building as we continue to report to duty and maintain operational readiness. We will continue to assess this, but at this point in time, the buildings that I'm tracking that are open for folks to be able to come in, like the building I'm in right now, the headquarters building, expect that folks from other buildings have business in here and need to come in here. The expectation is that everybody is practicing social distancing. If you can do the work via phone, okay, or email, recommendation is that you do so. But at this point, putting a access on the door and then making folks that need to do business in there actually creates the need for somebody to be able to answer a door where somebody may not even be close. And so at this point, that measure is not being implemented. So the last question. What is being done to address the hoarding of meats by commissary workers? I cannot say enough about the extra efforts that our service workers, whether they're in the commissary, the troop store, the bowling alley, the Frontier Club, and go on, are doing over and above what's normal, and frankly, not necessarily being greeted pleasantly because there's not everything there that folks want. The workers are not hoarding meat. It so happens that between the truck last week and the truck that came in today, the folks that came to the commissary bought all the meat out. And when I say all the meat, it's not literally all the meat. It's just almost all the meat. And I understand that one could say that there was nothing on the shelves in terms of meats and would not be far from the truth. We are working, as I said at the start, with the commissary agency, the DECA, to increase our supply, increase the distribution, and at the same time, we are limiting folks on how much they can buy at any one time to ensure you have what you need for now and we can continue to supply people. I would ask, when you go into one of these places which you cannot do via telework. I mean, think about, can you cook a meal via telework? Can you stock shelves via telework? And being able to do that on a day in, day out basis, please smile at them. Please tell them thank you for what they're doing. And please understand that they are doing their best, and they're not the ones that dictate when the trucks come, and we are doing our best to enable more stuff on the shelves. But really, if you've got an opportunity to notionally give someone a pat on the back, please don't touch them, okay? And please keep your social distance. Really let them know how important it is what they do. Now, having said that, the workforce here at White Sands has got an incredible mission. And that mission is critical to soldiers who are on the battlefield today and soldiers that will be on the battlefield moving forward. And the community here that supports them is integral to the ability to do that mission. And so I want to thank you all for what you do. I ran into an article and I just want to share a couple things. This is written by a healthcare professional who's kind of looking at the situation, and I'm not going to read it. I'm going to give you some highlights, and then we'll put a link up to the article so that folks can do it. But I'm going to read the lead in and then hit some highlights. And she starts, actually she doesn't start. I'm going to start with the middle. Many of us feel like we can't control much in our lives right now due to the threat of this powerful virus. But what we absolutely can control is how we react and what we do. I offer the following tips for how to turn this pandemic into a productive and positive experience while concurrently doing our part to maintain social distancing to support the nation's battle against COVID-19. So I'm going to hit some highlights of what she had, as I think that they are potentially pertinent, and I offer these as thoughts to ponder. The first one is lead. Make lemons out of lemonade and take the restrictions and challenges and see if you can create incredible opportunities. And lead among your family, your friends, and your colleagues, and be an example for others to follow. I think the next one she hits is incredibly important. Turn uncertainty into certainty. You got the choice. Do you focus on what you don't know and you can't know, or do you focus on what you do know and you can actually do something about? And there is so much of your life that you can control, and if you focus on that, then you get the opportunity to drive things forward. Community, okay? I think we've talked about that already. Immunity. Improve your immune system through diet and exercise. Eat well. Don't forget about vitamin C. Okay? Take care of your body, both in terms of what you eat, when you eat, and how you exercise, and help the rest of the community do the same thing. Time. Most folks complain you never have enough time. For some of us, we've got a lot more time on our hands now. For others, I understand that's not the case. But if you do have more time, are you taking the opportunity to do the things that you've always said you wanted to do, to include to-do lists and those sorts of things? Get outside, leverage technology, and stay connected. It's a wonderful opportunity to catch up virtually with friends and family that you maybe haven't taken the time in a while, and really understand where folks are. And when I say leverage technology, I mean the things are FaceTime, Skype, Zoom. If you don't know what Zoom, Skype, or FaceTime are, you know, there's a challenge. It's an opportunity to do other things. Don't hoard. And so why does everybody want to buy all the toilet paper for themselves? And thinking about where we're going. And be creative. And then finally, I mean, the final thing in terms of things that she recommends is win. And really the focus there is don't be a victim, be a winner. And you've got the opportunity to choose on what you want to do. And those are really points to ponder as we're going through this. And along those lines, I think there's a real question of how long is this going to go on. And folks talk, you know, we're doing this so that we take down the peak and we flatten the curve. And really, when folks are talking about that, there's a concern that our hospitals can only support so many folks. And so if we can flatten the curve, we can essentially buy more time to get more things prepared, maybe increase that capacity a little bit. But really, the biggest part of it is extending, okay, and being able to do this where that peak is drawn out, and what you're going to see is, hopefully, if we do things right, that peak is within what our medical establishments can handle. But what does that mean? Does that mean that we're going to be done and everything's going to be good 3 weeks from now, which is when New Mexico schools are supposed to go back? I would suggest to you, school may start back up. But as a nation and a world, this isn't going to be over in 3 weeks. And we need to think about this in terms of being able to sustain what we're doing and being able to move forward and being able to adjust to the conditions as they present themselves. And so while the conditions are enabling us to eat at someplace other than home, okay, that opportunity is going to be afforded to you, because we understand that this could go on for certainly more than 3 weeks. The Army's and DOD's restrictions on travel are essentially for 2 months until May 11th and then reassess. And so is that the end of the marathon? I think we'll see, but what I want, folks, is not to target April 6th when school is supposed to start back up, but to really be thinking about what am I doing so that I can adjust and protect my family through proactive hygiene and measures moving forward. And many of these things are just a healthier way of living. Some of them are restrictions, and we'll see what we can do based on the conditions moving forward. So a little bit longer, I think, than yesterday. We look forward to updating you again tomorrow. And really what I'm trying to do is give you as much information as I have, and the questions, please keep them coming in. Please share answers with your friends. We understand that for folks, you're not going to be able to stream this at work on a government system, and that is probably worth me taking one more minute to explain. And so as the Department of Defense puts more folks on telework, there's a need to enhance the capability of our virtual private networks, VPNs, to be able to handle that additional bandwidth that's being challenged. And as part of the measures to do that, streaming of videos is one of the things that has been restricted. And so if you say, hey, I'm at work and I need to see this YouTube video for whatever reason at work, and you call the help desk because you can't get to it, they can't help you because that's a restriction DOD-wide right now for those reasons. And we're going to see those where you see something that doesn't make sense, please bring the question in. And if there are things that we're not doing that you've got questions about, or things that we are doing that you've got questions about, please bring them in. And again, I can't emphasize enough having conversations with your supervisor. If you're a supervisor, that's your supervisor, and making sure those conversations are going up and down and occurring regularly. Thank you so much for what you do. Thank you for spending a little bit of time with me, and look forward to talking to you tomorrow.